Hi all, my name is Frida Martin, and this presentation will be about global responses to the COVID-19 pandemic. The agenda for this presentation will be to first introduce the topic by explaining what COVID-19 is, and giving some history on its origins and the timeline of events so far, and from there to talk about China's response to the pandemic. Next up will be the United States response, including the CDC, and finally the WHO response. COVID-19 is a novel or previously unidentified coronavirus that causes illness in people and spreads from person to person easily. Some cases of infection have severe symptoms, occasionally resulting in death. Due to the high transmissibility and the severity of some cases, the World Health Organization characterized the ongoing COVID-19 outbreak as a pandemic on March 11, 2020. The currently accepted theory as to the origination of the virus is that it came from the Huanan wholesale seafood market after jumping from bats to an intermediate animal and finally to humans. The seafood market, and by the way, the Huanan wholesale seafood market is in Wuhan, China. But the seafood market theory does make sense due to the array of different animals there and the amount of human contact with those animals, allowing for both species barrier jumps, and many of the first identified cases were also linked to the market. However, tissue samples of the various animals at the seafood market have found no trace of the virus, indicating that the species dump did not occur at the market. Furthermore, a substantial number of the cases reported in the initial outbreak, about 1/3, had no connection to the market. Additionally, the first confirmed case was identified on the 1st of December, but the first case with a connection to the market was identified on the 10th of December. Thus, it may be more likely that the seafood market was not where the species jump occurred, but rather was the site of a super spreading event. All this to say the origin of the virus remains unclear and continues to be investigated. Alright, so a brief timeline of events so far. On December 31st, a mysterious pneumonia cluster was identified in Wuhan, China, and then by January 7th, a novel coronavirus had been identified. We had not identified the name, or rather, we had not chosen the name yet, so it was being referred to as 2019 nCoV, which stood for novel coronavirus. On January 11th, the first death by this novel coronavirus occurred, and then on the 13th, 2 days later, the first case outside of China was reported. By the 20th, the first case in the United States was reported, and then 3 days later, Wuhan went on lockdown. On January 30th, the World Health Organization declared a public health emergency of international concern. On February 2nd, the first death outside of China occurred in the Philippines, and then on the 4th, the Diamond Princess was quarantined outside of Japan. On February 24th, the Italy situation quickly began to deteriorate, and I wanted to talk about this a little further, but I decided I should keep things somewhat brief for this presentation. So on March 8th, the United States saw its 500th case. On the 11th, the World Health Organization declared a pandemic, and then on the 15th, many states in the U.S. started school closures. 3 days later, on the 18th, Donald Trump, President of the United States, signed the Families First Act, which provided relief checks to a large population in the United States. The next day, California issued a stay-at-home order. On the 24th, 50,000 cases were reached in the United States, and only 3 days later, on the 27th, 100,000 U.S. cases have been confirmed. On April 2nd, the 1 millionth confirmed case occurred globally, and the United States reached 5,000 deaths. On the 6th, the United States reached 10,000 deaths, and China stopped seeing new deaths for at least that day. And then on the 10th, the 100,000th death was reached globally. On the 15th was the 2 millionth case, and then on the 30th, armed lockdown protesters stormed the Michigan state capitol with the intent to have the stay-at-home order lifted. On May 2nd, Eurostar began to deny service to people that weren't wearing masks, and then on the 4th, an inflammatory syndrome began to get linked to COVID-19 in pediatric cases. On May 5th, it was actually discovered that there had been a French case on December 27th. And then on the 14th, the United Nations warns of a global mental health crisis, which can be somewhat common following a pandemic or during a pandemic. And then on the 21st, the 5 millionth case was reached. And then on June 3rd, it was verified that hydrochloroquine is a placebo. And on the same day, it was discovered that George Floyd was infected at his time of death. On June 6th, months of COVID-19 data in Brazil were removed from the public eye. And then 4 days later, on the 10th, the United States reached its 2 millionth case. On the 16th, a steroid-based drug called dexamethasone reduced deaths by 1/3 in critical patients. And then the 24th is today, and we are at about 9.4 million cases globally. Wuhan, located in the Hubei province of China, is where the first cases of COVID-19 were identified. Although the first confirmed case, according to Huang et al., was retroactively identified on December 1st, the presence of a novel strain of coronavirus was not confirmed until January 7th. By January 23rd, authorities enacted a strict quarantine on the city of Wuhan. The lockdown was so rigorous that neighbors were monitored to make sure interaction did not occur, as the so-called war against the spread of the virus went underway. Public transportation, including airports, train stations, and buses, were shut down and sealed off. The rest of the Hubei province followed suit in short order, albeit to differing degrees by city. In Hong Kong, the measures taken were somewhat differently geared due to the aim being more focused on keeping the virus out than keeping it in. On January 25th, Hong Kong declared a virus emergency and took steps to limit connection with mainland China. These steps included canceling planes and high-speed trains between Hong Kong and mainland China, as well as the cancellations of all official visits to mainland China. Hong Kong was also on the tail end of protests for democracy and against an extradition bill, which further complicated responses to the virus by forcing government responses to be viewed more politically. The response from citizens in Hong Kong was surprisingly intense. Face masks were selling out, people were barricading themselves inside, and physical violence over toilet paper rolls were all taking place by mid-February, when less than 100 cases have been confirmed in the city of almost 7.5 million. In terms of the strength and speed that China's government responded to the outbreak, efforts were quite impressive. It is estimated that the Wuhan quarantine delayed the global flood of cases by weeks. This gave the rest of the world time to prepare for the pandemic, creating procedures and plans as well as testing kits. However, this robust, quickly put into place shutdown was only strong from the standpoint of once the Chinese government had acknowledged the presence of a novel coronavirus. Initial responses were actually an immense failure. To be more precise, the first doctors to raise alarms about a mysterious cluster of pneumonia cases were silenced. Li Wenliang, the doctor who initially tried to tell some people about the virus, including coworkers, was tried for rumor mongering, and then he later caught the virus and died. The trajectory of events in the United States has been a different story. The first case was identified on January 20th, and it is now speculated that person-to-person transmission began then, though this was not recognized at the time. This failure to catch the virus transmission early came despite contact tracing and testing those who were exposed to the case. The CDC was quick to develop testing kits for use across the country, but this may actually explain, at least partially, how the virus escaped early detection, as the testing kits were contaminated and unreliable. Several states across the country quickly determined that some of the tests were coming back inconclusive, but it was not until February 12th that the director of the CDC's National Center for Immunization and Respiratory Diseases confirmed that testing kits were faulty, weeks after the first case in the US. However, one thing the CDC has done quite well is to rapidly disseminate new information and create constantly revised and updated guidelines for a variety of COVID-19 related things. For example, the CDC offers guidelines for how long-term care facilities should proceed at this time, including steps to prevent transmission within the facilities. The CDC is one organization we can expect leadership from during a pandemic, but what may have been somewhat more surprising is the way California forged a path for other states to note and adapt for their own. California seemed like it might have lost control of the outbreak early on, It was the first state to confirm the occurrence of community spread, and even before that, it had a number of cases being imported. However, it reacted to these events strongly and was the first state in the country to issue a stay-at-home order. This was met with a good deal of criticism, but the state government did not sway. As it turned out, this decision would be the same one made by states all across the nation in the weeks to come. This is only speculation, but perhaps California's early decision to do so paved the path for other states to follow suit much sooner than they otherwise would have. If this is the case, then California's early stay-at-home order had a literally immeasurable effect. New York had a different story. The first case in New York was identified on March 2nd. However, New York City is not only the most populated city in the country, it is also extremely busy. These and other factors contributed to the explosive transmission rates in the state, and by March 21st, 19 days after the first case, there were over 10,000 confirmed cases. New York quickly became the global epicenter of the pandemic. However, this is not to say that the state failed miserably, and New York was actually a likely candidate to become the global epicenter due to the high rates of activity, tourism, and population size and density. In fact, New York made important decisions to limit the spread from being even worse. For example, on March 20th, Governor Andrew Cuomo issued a stay-at-home order. Still, many people criticized New York's response as being ineffective to limit the spread of COVID-19. According to Sexton and Sapien, this stay-at-home order came much too late and over petty squabbles between NYC's mayor and New York's governor nonetheless. They also posit that New York used insufficient data to guide their shutdown-related decisions, such as school closures. Another important organization in the unraveling of events has, of course, been the World Health Organization. Much of the world relies on the WHO for guidance and information during public health crises, especially on the international or global level. This is evident when looking at the progression of the outbreak and the global response to it. For example, the WHO declared COVID-19 to be a public health emergency of international concern on January 30th and a pandemic on March 11th. Both of these decisions not only show the importance of the role the WHO plays, such that these declarations are theirs to make, but it also shows that the rest of the world accounts for the WHO's assessment of how serious an outbreak such as this is. One of the reasons the WHO cited for declaring a pandemic was being alarmed by the level of inaction the world was responding to the crisis with. And this speaks to another related role played by the World Health Organization as an early alarm raiser. When the global public health response was insufficient, the WHO raised the alarm that more needed to be done, and this function serves to rouse action from countries and regions that may otherwise have not considered action necessary or worthwhile. The guidelines and protocol released by the WHO, along with its ability to sound the proverbial alarm, indicate that the World Health Organization plays a role as a global advisor. Another critical service the WHO provides to the world is dissemination of public health information. Not only does it offer technical guidance to countries, I should say, it also gives advice to the global public. This advice includes Mythbusters dialogue, where they answer questions such as whether it is okay to exercise while wearing a mask, which, for the record, they state is not at all advisable to do. So my recommendations are to comply, act, and reopen slowly, or as I like to call it, CARS. Breaking it down in more detail, these recommendations are both for authorities and citizens in the comply section, but geared towards authorities for the act and reopen sections. One of the best things a country can have in shutting down the transmission of this virus early is a cooperative population. This can be seen with the protests that began to spring up across the United States, as they sometimes resulted in reopening too early and cases spiking, and even when this attempt failed, cases were still pushed up by the gathering of a non-compliant community members into a dense crowd. Whether or not the protest is successful, the end result is more cases and probably more stay-at-home orders ensuing it. As for organizations, governments, and directors of facilities, following the guidelines provided by the CDC, the WHO, or by a government is highly advisable. Not only are these guidelines built on evidence, they are also optimized to balance minimizing cases with functioning as normally as possible. In a pandemic situation like this one specifically, following guidelines set by authorities is ultimately going to be the most cost-effective, high-quality response, as failing to comply with these guidelines will either result in higher disease burden, further loss of function, be it a government facility, a health facility, or a business, or both. When authorities act, they should do so with great haste and very robustly. If time is spent waffling on whether or not to shut down, close schools, or the like, that time serves to allow cases to multiply, as seen with New York's response earlier. In addition, if the response is not thorough, the response is not effective. For example, a swift response would be to immediately begin closing schools, but if only some schools close, this response is not very robust and will potentially not even be very functional or useful. Lastly, actions should be strictly enforced. In China, for example, the Wuhan lockdown was highly enforced, with drones even flying around and scolding people for not wearing masks. The caseload dropped to almost zero new cases for long periods of time as a result. In the United States, stay-at-home orders are generally unenforced, and people are not reprimanded for going out and about as they please, including visiting friends and gathering for parties. It is little wonder that the US has by far the most cases in the world. Finally, authorities should reopen slowly. All of the actions taken to this point can be completely nullified if reopening is not done carefully and methodically, as several states are demonstrating across the country right now. It can be tempting from an economic standpoint to reopen quickly and fully once cases drop, but the havoc that the virus demonstrably wreaks on economies goes to show that opening quickly, not acting robustly, and the like will all lead to a greater toll despite briefly having higher productivity. And then here is my first reference slide, and I'll go to the second one in a few seconds. No pun intended. And here is my second references slide, and that would complete showing all of my references, and thank you for watching.